Achoo! Oops moments do happen in pregnancy. They're really common, but they're preventable and really treatable. Have a watch it in the save of this video. And I will just label this as an ad purely because I've got a bunch of period pants in my hand, and they are absolutely incredible for being able to catch any urinary incontinence that you may have. They're also great for the environment, and they are great for periods. They're completely reusable. You just chuck them in the wash and they will wash each time. But they are a fantastic asset whilst you are having treatment for urinary incontinence in the interim period. And they will save you money and last absolute years. Now, there are many risk factors for urinary incontinence that we're going to go through, but the main reason why pregnancy increases the chance of urinary incontinence is because the baby, the placenta, the waters, all of that is increased weight on your hammock of muscles down here. It puts additional stress and strain on that pelvic floor that means that urinary incontinence is more likely, particularly as you approach older age. And there is nothing to be ashamed of when it comes to urinary incontinence. It's incredibly common, but it's remembering that it's also entirely treatable and it can be prevented in a lot of cases. And if you are pregnant and you take nothing else away from this video except this, do your pelvic floor exercises in pregnancy. All of the research highlights that the more pelvic floor exercises you do in pregnancy as a woman, the less likely you are to have urinary incontinence in the postnatal period. And there are some great resources from the Squeezy app to seeing a women's health physio that you can go and have a look at. There are also some other brilliant apps out there, and there's the NHS advice. Do your pelvic floor exercises every day, and if you can combine it with something that you do on a day-to-day basis, like washing your hands, like driving the car, for example, like going to work and picking up a pen, every time that you do that same action, also squeeze your pelvic floor at exactly the same time. Me as a midwife, every time I talk about pelvic floor, I do my pelvic floor exercises. And never suffer in silence. Speak to your GP, ask for a women's health physio referral, and some hospitals post-birth will automatically refer you to a women's health physio after birth or a pelvic floor specialist. And that is happening in lots of hospitals up and down the country now because of the women's health agenda that has been put in by the government. So it's worth asking and finding out what your local support services offer. And there are different types of incontinence. Stress incontinence is the one that is most likely after a vaginal birth compared to any other birth mode. Also more common after an instrumental birth than a vaginal birth. And stress incontinence is where you wee a little bit when you cough or laugh or where you sneeze. Urgency incontinence is when urine leaks just as soon as you feel a sudden intense urge to pee or soon afterwards. Overflowing incontinence is chronic urinary retention. That's where you're unable to empty your bladder and that can cause further leaking. And total incontinence is where you can't store any urine at all and you constantly pass urine. Now, there are lots of research studies you can read highlighting that there is a link between vaginal birth and stress incontinence. And all of the research studies highlight that there is an increased chance with instrumental birth over a spontaneous vaginal birth. And the other risk factors for developing stress incontinence after birth is having stress incontinence during your pregnancy. And the chance of having urinary incontinence in pregnancy is around 39 to 40% of women. Women who had urinary incontinence in pregnancy were far more likely to have ongoing symptoms of urinary incontinence postnatally and also a year plus down the line. So this is why it's so important to do your pelvic floor exercises during your actual pregnancy. And one of the most common questions I get asked as a midwife is, does a caesarean birth stop you getting urinary incontinence in later life? And the answer to that is in relation to stress incontinence, it reduces the chance of stress incontinence. It has no other impact on any other incontinence. And it isn't completely eradicated because pregnancy in itself is enough of a weight on that pelvic floor to weaken it. But there are some women for where a caesarean birth as a primary method of birth, so this is the very first birth that you've ever had, can reduce the chance of urinary incontinence in later life. And for women who are over the age of 35, for women who are having babies over 4 kilograms, and women with a raised BMI, a caesarean birth was found to be a protective factor in reducing the chance of stress incontinence in the postnatal period. And you can see from this particular study, women in the stress urinary incontinence group, 86% of them had had a vaginal birth compared to 13% who'd had a caesarean birth. This was their very first birth. None of them had ever had a vaginal birth or a pregnancy prior to this very first pregnancy. And so it lowers the chance of developing stress incontinence postnatally, but it doesn't eradicate it by having a caesarean. really highlighting the importance that everybody, regardless of what mode of birth you're having, needs to be doing their pelvic floor exercises in their pregnancy. And if you do have any urinary incontinence, seeing a women's health physiotherapist, they'll be able to go through those exercises to you, they'll be able to assess you properly and provide the right plan of care for you. If pelvic floor exercises are not sufficient or not appropriate for you, surgery is another option to be able to go down the route of. They will talk you through this. It is an option for women, and like I said at the start, please never suffer in silence. Urinary incontinence is completely treatable, but we need to be speaking up and advocating for ourselves to get the right treatment for our own individual basis. And going back to period pants, they are the most comfortable thing I have ever worn, and literally they make you feel dry when you are having points of urinary incontinence. There are so many different brands on the market, and you can get different absorbency levels as well. You can also use a code that I'll put there for the nappy lady. These are fantastic. They're great in pregnancy and they're great for postpartum.